Good morning and welcome everybody whoever is attending my lecture series. Now today I will deal with postdural puncture headache and epidural blood patch. When the dura is punctured for diagnostic or anesthetic purposes, loss of cerebrospinal fluid occurs. In some patients, this results in a postdural puncture headache, which is known as PDPH, the symptoms of which range from mild to debilitating. It is important for the anesthesia provider to consider the differential diagnosis of headache when evaluating a patient with a suspected PDPH. Pathophysiology. Dural puncture results in loss of CSF. The pathophysiology and mechanism of PDPH is poorly understood. Commonly accepted theories are traction on the pain-sensitive structures due to pressure changes in the cranium, cerebral vascular dilatation. Symptoms. Characteristics. Onset is usually 12 to 48 hours after the dural puncture. PDPH is located in the frontal or occipital region. Accompanying symptoms include neck pain, visual disturbances which may be due to cranial nerve pulses, photophobia, nausea and vomiting, dizziness and auditory changes. Double vision is possible due to traction on the sixth cranial nerve. Positional changes. The classic symptom of PDPH is that the headache is relieved upon assuming the supine position and worsened in the upright position. Incidence of headache with dural puncture depends on several variables. Number one, needle size. In general, the larger the needle, the higher the incidence of headache. Needle type. Pencil point needles, that is Whittaker or Sprout, have a lower incidence of headache than cutting point needles like Quincke needles. For example, a 26 gauge Quincke needle has a PDPH incidence of 5%, while a 25 gauge Whittaker needle has an incidence of approximately 1%. Bevel direction. If a Quincke needle is used, care should be taken to orient the bevel of the needle with the longitudinal axis of the spine, as this decreases the incidence of headache. Patient characteristics. Female patients and or those younger than 40 years have a higher incidence of PDPH than male patients and those over 60-year-old. Morbidly obese patients have a lower incidence of PDPH. Patient evaluation. The patient must have a thorough history and physical examination. The onset characteristics, severity and exacerbating factors should be determined. A thorough chart review should focus on coexisting disease, vital signs, especially temperature and blood pressure, and laboratory evaluation such as white blood cell count. Physical examination should be focused on ruling out neurologic deficits. Differential diagnosis: preeclampsia. Hypertensive disorders of pregnancy are often accompanied by headache. Musculoskeletal headache. Patients may have muscle tension from lying in bed. Postpartum, patients may experience muscle tension due to breastfeeding. Caffeine withdrawal. Patients who regularly consume caffeine may experience the headache when the caffeine is withheld. Pneumoencephalus. Immediate onset of severe headache can be associated with pneumoencephalus due to the onset of the loss of resistance to air techniques for localizing the epidural space and subsequent unintended dural puncture. High inspired oxygen concentration can result in improvement of symptoms. Subarachnoid hematoma. Sudden onset of severe headache and or accompanying neurological deficits may be the result of a ruptured cerebral aneurysm and or arteriovenous malformation. Venous sinus thrombosis. Peripartum patients are at higher risk for this condition, and many will have undergone dural puncture for labor analgesia or cesarean delivery. In these patients, the headache loses its positional nature and or other neurologic signs and symptoms are present over time. Subdural hematoma, that is decreased CSF volume from dural puncture, rarely may result in the bleeding from the cerebral vessels. Migraine. In patients with a history of migraine headache, it is important to differentiate between his or her typical symptoms and PDPH. Meningitis. The presence of fever and nuchal rigidity is an ominous sign in a patient with a headache. Antibiotic therapy must be started in a timely manner. Okay, this part ends over here. Next part will be with my next video lecture. Thank you.